Hi, Sunday morning, 9 o'clock. What are you up to? Still isolating, obviously. I got my drinks. I feel like I might need to drink more today. For some reason, I'm feeling a little dry. Today, in my mug, I have Earl Grey tea. Hey, John, I know you're tuning in. You can't wait. We were talking about it last night. See you soon, he says. All right, I'll see you. Holding you to that. You know what I was just thinking about? This whole toilet paper thing. As a nurse, we would kind of joke a little bit when the ladies, the older ladies, like 80 years old, they would use like one ticket, one square of toilet paper. And I remember thinking like, girl, just grab like 12 tickets. It is what it is. This is not a recession. This is not the depression, blah, blah, blah. So maybe it's all coming around full circle. Like maybe it's like they knew something. They were like, yeah, we had to conserve toilet paper because we fucking lived in a depression. Okay, so here we are. We're hoarding toilet paper. Like it's a thing. Like this is just like fashion. Everything comes around full circle. So here we are with the toilet paper crisis again. So hopefully it's settled down. I don't know. What do you guys think? I just have to check in and see how everyone's doing. Hi, Miriam. Good morning. Beautiful to you too. Ali. Good morning, sunshine. I'm so happy to see you. Ali's my Frezin. So we're friends and cousins. So we've deemed it Frezins. Because that's what you do when you live your fullest life is you create fun and interesting terms for each other. So, So what are you all drinking this morning on Sunday? Is it coffee? Is it water? Is it tea? Hi, Frezin. That's fun. Like I say, I'm drinking tea. I may need a little bit more water. I got a little bit of a thing. Don't worry. It's not the thing that we're not going to talk about because I haven't left my house in forever. I just have been talking a lot and laughing a lot. So lots of water. This is not actual Fiji water. It's just tap water. Okay. I have nothing insightful to say right now, except for the toilet paper comment. So we might as well just kind of dig in. Do you have your foam roller? I have this nice 3-part system here. I also have some roller balls. I didn't know how deep we were going to get into rolling. Haha. Do you like that pun? If we were just going to stick to foam rolling, we're going to do some stretches. We're going to do some ball work, whatever. Let's just kind of let it flow however it needs to flow. I wrote a few things down about what I wanted to say. So foam rolling helps to treat sciatica, piriformis syndrome, low back pain, knee pain. Hi, John. Good morning. Sciatica, low back pain, knee pain, plantar fasciitis, if you've ever had that. Pronation of the feet, which is where the feet rotate in and then create flat or fallen arches. So this is very important. If you have any trouble walking, they call it gait or ambulation, then foam rolling will really help that too. So how it works is it helps to release the fascia over top of the muscle. So fascia is, I've said it before, the way that I look at it is a mesh onesie. So it goes from the top of your head all the way down to the tip of your toes. And if that's tight anywhere, it's just like a shirt. So I'll show you, pull my shirt. So if it's tight up here and then you pull, then the whole shirt comes up. So that's basically what fascia is. It holds everything tight and together. All of your muscles, like the big parts in the muscles, every individual muscle fiber, it's in and around your organs to keep your bowels and your spleen, liver, stomach, everything where it's supposed to be. So it's a very important part of your body. And it really needs lots of hydration too. So that's also why we drink so much water, is because we're trying to hydrate this fascia that is this nice tight onesie that we're trying to move around all the time. So your muscles might be hydrated, but your fascia definitely needs hydration. I think it's like 60% or something. Not good with numbers. Anyway, foam rolling, important. I've told you what it treats. It helps to also relax the upper body, the jaw. Hey, Lori. Even into the head, like if you have TMJ or you have really tight neck, if you relax and roll your glutes, your quads, hamstrings, even just your lower leg, that will help to have everything flow nicely as well. So that's basically what we're going to roll today too, is we're going to do glutes, we're going to do hamstrings, then we're going to turn over, we're going to do quads, and then I may help you with the lower legs. I may just kind of tell you what to do depending on what time is and everything. And then if you want, we can use a ball and that'll get deeper into the glutes, which I think is very important because there's, I don't know the number, again, not a numbers person, but there's like, I don't know, 10 different mini little glute muscles that help to rotate the hips in and out. Like they're the tiniest little muscles. You would never even think to Google them. But yeah, if they're tight, then they really affect everything. So that's something to think about. Hallie says, I'll check back after my workout. Thanks for all the wonderful information. Good. Enjoy. Hi, Joanne. Nice to see you too. Good morning. This is great. Yeah, we're just talking about what foam rolling does and how you can use your foam roller properly. So hopefully you're kind of comfy. You've done some deep breathing. You're feeling really good and nice and relaxed. A little bit more water for me. Great segue. Hydration is very important because if you're trying to stretch, roll, work out, do anything when you're dehydrated, that's when you're probably going to pull something, whether it's a hamstring, it's low back. Excuse me. So get comfortable, do a little deep breathing while you're listening to me talk, drink some water, get your coffee, get your tea, whatever floats your boat. And let's do it. I think that's all I really wanted to say. So let's just dive in. I'm really going to tailor this to having a foam roller because I think that so many people have asked me about how to do it properly. So let's talk about that. If you have any, if you want to know any stretches instead of foam rolling, then let me know. We'll talk about that later. All right. So I always start with glutes. Glutes are the best thing in the world. I talk about them all the time. So let's do it. Okay. So the angle, I don't know if you're going to be able to see properly, but I kind of just start with right over top of my sacrum, just a little bit. So that just helps release my SI joints. So I'm putting it just in the middle of my low back. So right here. So just doing that nice and gently. You don't want to force this. You don't want to try and become your own chiropractor and trying to adjust yourself, because that always ends in disaster. If you are gentle with your body and relax the muscles, then you can move your joints on your own. So that's usually what I do. If you have any questions about anything, just pop it in the comments. I may not have a whole lot to say because it's kind of self-explanatory. So if you do have questions, let me know. So now I'm going to move over to my right glute. So I'm kind of on the roller on an angle. And let me know if you can feel that. My glutes are they're not too bad. But I did go for a run yesterday and they're a little bit sore. When you're rolling too, you want to try and get the muscle that you're rolling to be as relaxed as possible. So even thinking about, okay, can I relax that glute muscle even further? Yep. Can I relax any further? Yep. And really tune in mind-body connection. So you want a lot of awareness. with this, with any stretching, rolling, anything. I'm actually going to back up a bit because I do need a bit more room. So I like to kind of move around. So you should be right on the side of the glute here. So that's going to roll that glute med. Remember when we were doing the booty exercises? So this angle that we're on is going to get that glute med. Hi, Marianne. It's fun. So we're just rolling. If you have your foam roller, Marianne, grab it. And we're working on glutes first. I always start with glute. Start with glutes first. Hi, Kyle. This would be really good for you, Kyle, with your injured back from a while ago. Okay. So how's that feeling? You ready to progress a little bit? So I'm going to move down again because I do a lot of sliding around. So now I'm going to come up and do the glute max. So again, glute max is the meaty part. And so to get the meaty part, you roll, which way am I going? Down. My body's coming up to get the glute max. So you can see. So we went from here, glute med, little movements, to now we're getting the entire glute max. I'm still on a bit of an angle so that I'm not getting any of my bones in there, like my sacrum. So just think about where that, hi Chloe. You're a champ. Thanks, Kyle. You're the best. So yeah, Chloe, we're just starting with glutes. We haven't done a whole lot yet. We're just doing the glute med right here. So just little movements like this, just to get on that glute med. And then when you're ready and that's all warmed up, you're just going to take a little bit further to the glute max, still staying on an angle. Again, you don't want to have too much pressure over your sacrum, which is your bone. Obviously, there's not a lot of muscle in there. I don't think there's any muscle. No, it's just a bone, except for everything around it. So I'm kind of coming up. I'm really thinking about where my glute max is, having that awareness, and trying to roll the entire muscle. That's it. Again, super slow. This isn't something that you want to do too quickly. I found a spot. I think that's my piriformis. So if you find little spots that are kind of like, ooh, what is that? Then just stay on it, hold it, see what happens. I can't see one. Alicia? Is that Alicia? Hi. I just felt a little movement in my SI joint. You feeling any of that? So again, I'm just holding. I got on my piriformis, which is a very deep glute muscle that rotates the hips in and out. Hi, Gary. Wow, thanks everyone for tuning in. This is like one of my favorite things to talk about, and I'm really happy that you're here and that we're doing some rolling. So in massage, we learned the principle of superficial, deep, superficial. So that's why I'm saying to do the glutes, like glute max. Once you've relaxed your glute max, which again is the meaty part, then you're able to get down deeper into the piriformis and all those other muscles that rotate the hips in and out. I see there's more comments, but I'm too far away. I can't click and see who's all coming on. That's okay. I'm going to reassess. I'm going to check the comments. Keep doing what you're doing, and then I'll show you how to now go onto your hamstring. So we're going to do one leg at a time. Alicia, hi Lisa, nice to see you're doing well. I miss you too. Aww. Oh my god, remember that. Sorry if I'm being annoying. What do you remember? Remember glutes? I remember you squatting in class a lot. So Alicia and I did massage therapy. Oh, you remember the superficial, deep superficial thing. Right. That's fun. Okay, so let's move on to Chloe says, oh my god, feeling it. There's Helena too. Sorry if I'm being annoying. Oh no. What do you remember? Remember glutes? I remember you squatting in class a lot. What's happening? Alicia and I did. Am I even live anymore? Massage therapy. Oh, you remember the superficial, deep superficial thing. Right. That's fun. Sorry, guys. I clicked on something and it took me like to this video, which is super weird. Anyway, hope you're still rolling. So if you need to move your roller down, because I keep sliding towards the wall. Once you've got your glute max feeling good, hey, beautiful Helena, you're the best. So now you're just going to go right over top of the insertion of your hamstring. So this one might get a little bit tricky. I can actually sit down onto this part of my hamstring, but maybe you can't. That's okay. If you need to brace, then have your other knee up. Yeah, I like it down because I can just totally put all of my pressure and all of my body weight onto that hamstring insertion. So hamstring insertion, you're gonna have to look at my butt for a second, is right here. It's called your ischial tuberosity. It's right under your glute. So this right here is getting that tendon that's attached to your ischial tuberosity, your pelvis. And so once you kind of sat on that for a few minutes or seconds, whatever feels right for you, you just roll back and you start to really relax that hamstring. So you can stop wherever it feels good. You can, again, have your foot up like this so that it's not quite as much pressure. Just be gentle, be careful. And then come back to that ischial tuberosity. I'm going to move over again because I need more space. So I'm right over top of that hamstring. Again, I'm just going to roll both of my legs straight. And if you want to get the outside of your hamstring, turn your foot out. Like rotate your foot from your hip out a little bit. So that'll help to get that lateral or the outside of the hamstring because you have more than one. And then just come back. Oh, my leg's shaking. How's yours feeling? And then just come back. Ooh. So again, let's do the outside. So rotate your foot out a little bit, and that'll get that lateral one, which sometimes the lateral hamstring is tight because it helps to externally rotate the hips. And as I was saying with the glutes, you want your hips and your legs to be more externally rotated than internally rotated. So if your hips aren't doing it, then your hamstring's going to want to take over and help to externally rotate that hip. So you may feel more tightness in the lateral hamstring than the medial or the inside. So if you're feeling like, all right, I got that lateral hamstring feeling pretty good, I'm just going to do one more pass over. I bring it all the way down to the knee because that's where the tendons insert into the leg. So you always want to get muscle, but you want to get the tendons as well because they both have receptors. The tendons have different receptors than the muscles, but both are sending signals to the brain to say, I'm going to relax more. So coming back to the ischial tuberosity, And then changing how you're sitting. So instead of being so far over to get the lateral muscle, come up a little bit more, like be a little bit more neutral, and then go back. So this might be a little bit harder for you. Again, I have both feet straight, but if you need to, just put one foot down. It might be a little bit more cumbersome, like you might have to kind of sit down and really put some force on your hands to get that. So that's a good one. Let's do this. So put your hands down if it feels right, and keep your leg as straight as possible. And then come forward or this way. And even if you need to put your bum down, that's okay. Just trying to get that pressure on that hamstring. It feels good. How are you feeling? Do you feel that even in the adductors or this part of the leg on the leg that you're working, obviously not the other one? So that helps to get those adductors too. I need to reassess my mat here. Okay, keep doing that. I'm just gonna check and see. I'm sitting on my glute max right now with a cup of coffee and working my biceps. Good job, Elena. Look at that ischial tuberosity. Definitely going to use these stretches. My roller is gathering dust in my closet. Thank you for these videos, girls. Stay safe and healthy. Thanks, Alicia. You too. Yeah, don't let the roller gather dust. All right, how are we feeling? We'll do one more pass. We'll do the full chain again. So we're going to do glute med. We're going to go down into glute max. We're going to go on to the upper portion of the hamstring, ischial tuberosity. And then we're going to bring it down, lateral side first. So rotate your foot out a little bit. And try and get all the way down to the knee. Right here. Just be gentle because the knees are tricky. So just be careful. If you can't get all the way down, that's okay. We're going to go back. Now you're going to reset. You're going to go straight. And this will relax the other hamstring muscle. If you need to, sit down. And then try and get that insertion again right around the knee. Just be careful. All right, let's do a little bit on the other side. You got to stay balanced. Ooh, my SI joint's a little bit angry, but happy all at the same time. Okay, so I'm going to face this way just a little bit. Actually, you know what? I'm just going to turn. How are you making out? You guys doing okay? So again, angled this way a little bit on the glute med. So all of these rolling exercises, everything that we're doing now, it really does help to relax the sciatic. You know, if you have any issues with sciatic nerves, if you have piriformis syndrome, which is a tight piriformis that goes over top of the sciatic nerve, because sometimes it's not true sciatica. True sciatica is where the nerve actually gets impinged by the sacrum. And so it's a little bit trickier to deal with if it's not related to muscles. Piriformis syndrome is very similar to sciatica. but it's just a tight piriformis over top, because the piriformis either goes over top of the sciatic nerve or the sciatic nerve goes through the piriformis. So if you relax the piriformis, then that numbness and pain and tingling and everything will go away. I also mentioned, as I said before, the superficial, deep superficial principle, that if you relax the glute max, what we're doing now, then you'll actually be able to get at that piriformis a little bit better. I see Joanne has a comment. Didn't realize how tight my hamstrings were. Oh, you're welcome. I am the light to show everyone how much pain they're actually in. So moving on to glute max. Oh, this one's a bit tighter for me too. Good one. I don't know how much you all are gonna like me when we start to do the quads. Oh, they don't feel the nicest, especially when I'm massaging my clients. I'm like, sorry, it's probably gonna hurt a lot, like more than what you expected for the day. I apologize. Thank you, clients, for putting up with me, letting me massage you, even though you're probably walking in going, ooh, what's she gonna do today? So just on my ischial tuberosity again, the upper portion of the hamstrings, which when we do lunges and you get that mind-body connection at that junction, the upper hamstring, like the tendon into the ischial tuberosity, if you can focus on that and engage that, it will help perk up your butt 10 times more than what we already did with glutes. So I'm so excited to teach you about lunges, but I really wanted you to do some rolling first, because I don't want you to be tight in any way when we do lunges, because it can cause knee pain. It can cause low back issues. Like, I really want you to be nice and ready to rock and roll before we do that. So I'm going to come a little bit closer. So we're going to go down the hamstrings. We're going to do that lateral side again. So you're going to want your body and your hip to be more towards the outside. There. Oh, that's a good one. How are you feeling on that one? Whew. Miriam, hard for me to get down on the ground because of my shoulders. Is there another way? Another way to do foam rolling? Is that what you're asking? Yes, there is another way. Do you have a rolling pin? This will be your best friend. So if you have a rolling pin, I'll show you just after I'm done this how you can use this to stand and relax your hamstrings and your quads. So I would assume it would be hard for you, Miriam, to get down onto the ground to do quads as well. So anything that is a handheld roller will work. Yes. Okay. Perfect. So go get your rolling pin, and I'll show you how to do that. Oh, this is so good. Oh my gosh. Miriam, your shoulder must be pretty frozen, eh? We need to do more with that. I'm going to do some upper body exercises, but I don't know if your shoulder's going to be ready for that. We may need to do more foam rolling or more rolling with the ball for you before we do any shoulder stuff. You can do lunges if your sciatica is okay. Oh, there's a few little spots in there. Again, just kind of hold on the spot. It's my piriformis too. What's your music? What are you listening to? What are you drinking? Coffee? I had coffee yesterday for the first time in so long, and oh my gosh, I was like jumping all over the place. Like, it's time for a run. Okay, I gotta do this. How about that? So remember, when you're on this side, you want to be a little bit to the side when you're doing that lateral hamstring. That one gets me every time. Okay, so let's do the neutral one. So you're upright more, your foot and your leg is straight, and then you're just coming back. Is this hard, or is this pretty easy? Rochelle, hey girl. Oh, good. Miriam, you got your hand one. Okay, perfect. Okay, so everyone keep doing the hamstring for a few minutes, and I'm going to stand up, so you may not see my face, but what you can do, Miriam, is take your hand held in between your legs like this, and keep your legs somewhat bent, and you can roll that all the way up and down your leg. You want to go to the side, just like we were doing, but then you also want to do that middle. Be careful on this. I'm finding it's a little bit sore, maybe because my hamstrings are tight. So just be aware, just be gentle, and get right up to the ischial tuberosity as well. And then to get your glutes, I would say grab a ball, tennis ball, and then sit. So everyone else too, this is something you can do for glutes, is again that superficial, deep superficial. So using your ball and then putting it on a few spots in your glutes. I'm gonna use this one, you can see it better. And then you can roll around, just be careful because it is more focused, more central. But I would recommend everyone do this one. So you can find different spots in your body and your glutes. Okay, are you ready for quads? It's gonna be so good. And Miriam, what you can do while we do laying on the ground quads is you can go like this and then relax your quads this way. You can stand and do it with your leg straight. So just like kneading dough, squeaks and all. Okay, so Miriam, you give that a whirl, and we'll try this. A little drink. How's everyone doing for time? Okay, I think we're still doing pretty good. Okay, so this is my typical, I go from the glutes to the hamstrings, all the way down, do. And then I flip over like this. I put both of my legs like this, but it's because I can handle the amount of pressure that the foam roller is doing for me. But if you can't, put your foot like this, and that'll take some of the pressure off of that spot on your quad. And you just go all the way from the top of the quad up here in the hip, all the way down to the knee. You don't want to go over top of the knee, obviously, that's a bone. But you want to do the full distance. So again, like this is probably where you want to be. And then all the way down. I can't see me anymore. Oh, this spot is so brutal. So brutal. And again, I'm going all the way up to the insertion or the hip flexor. So you can even stay here for a few minutes. You can relax there. That'll help to indirectly relax the entire quad as well. Oh, these babies are tight, especially if you sit a lot or even cross your legs a lot. Like if I'm in like the lotus position, that still puts strain on my hip flexors and my quads because I'm still pretzeled. So, I mean, that's why I think yoga was created. You can't just sit there and meditate forever and always. You do like a movement meditation, which is called yoga. You can foam roll. This is a good way for me to relax my body and do a little meditation at the same time. You can listen to some nice music. You can watch TV. It's pretty versatile. Just get on the floor or use the handheld thing. I'm just kind of hanging tight here on my hip because I find if you can, I'm pretty well straight. Like I have a little bit on my glute min, my hip here, but that just helps me to relax the whole hip. You can kind of move around, feel what feels good, what feels tight. And then when you're ready, start to move on. Move down through the base. It's like I'm flying. Oh, a couple spots there. You want to do the whole quad, but the most important one is the external one or the lateral one. So that's on the outside of the leg. So that is here. So you really want to work those or roll those because what happens when we have that internal hip rotation, everything gets tight on the outside and then it travels all the way down the leg and into the ankle. So if you can relax everything that's internally rotating the hip, then you will have better success and it's just more effective, more efficient. Because typically the inside is tight because the outside is tight. So the inside is getting tight because it's trying so hard to pull the hips out or at least have no pressure on it. So that's something to think about. So always roll the outside of the quads for sure. So I'm almost parallel, but you can, if you want to get more of the outside, you can bring your leg back and use that as leverage here so that you're not putting all of your weight onto your quad because it probably hurts, especially if you haven't done it in a long time. That's okay. And if you open up just a little bit, then that will get you right to that external or that lateral quad. Might even hurt a bit more. Ooh, that's a good spot right there. You can just chill on the spot and that'll be like a trigger point release. It'd be like me massaging and putting my hand there and waiting until it releases. Do you even feel this into your toes at all? Because if your toes are tight or your feet are tight, it might actually be coming from your hip, which typically it is anyway. If you have bunions, this will be really good for it too. Trying to get the quads and the fascia and everything moving around and relaxed. So how are you doing with this one? So open up just a little bit. Put the pressure on your other foot, the non-rolling foot. And then find that lateral quad. It's kind of like when I said when you work the lower abs, it indirectly works the upper abs. So if you roll the lateral quad, it indirectly helps to just naturally relax the medial quad. What are you saying, Michelle? feel like every single spot on my body is a trigger point release. Yeah, I hear you, girl. Especially right now. Oh my gosh. And drinking water. So don't forget your water because that'll help to relax everything too. So in essence, I'm giving you a workout. Like this is breaking up muscle so that it can be repaired. My knee, so I'm just kind of going very gently around the knee where the quad inserts. You don't want to go right onto your knee, ever, ever, never, ever do that, please, because that would hurt. But just kind of go right here, right where the tendon is probably tight, and you can hold it there. You can relax on that. Even that'll just help to relax the quad. You're also getting an upper body workout. I'm a bit sweaty. How are you doing? Oh, so good, right? So you can make this into like a little dance for yourself. A very slow, methodical rolling dance. So I'll even come up, I'll get that lateral quad again, I'll get the lateral hamstring a little bit, and then like I'm constantly moving. You can't even see me. Now I'm back up to the glutes, and then I'm going back to the hamstring. And then back to the quad. And then when you've done the lateral, you can do the medial quad as well. So I'm pretty well neutral. You can kind of feel the intermediate quad. I can't remember what it's called now. Quadratus intermedius. Did I make that up? I don't know. Can't remember. I just know what it does. So that one actually, the rectus femoris is in there too. So that's the middle one. It attaches from your hip all the way down to your knee. So it's technically considered a hip flexor as well. So that one, when you're sitting a lot, it gets really tight because it crosses two joints, as opposed to the other quads just cross the knee joint. So rolling this one right in the middle of your thigh will help to relax your low back a lot as well. So I'm going to show you what I'm doing. So rectus femoris is done. Rectus femoris? I can't remember. Yeah, rectus femoris is from your top of your hip down to your knee. So I'm rolling all the way from up here all the way down, and I'm going super straight. You might even feel something nice in your SI joint. So always wanting to go really slow with foam rolling because you don't want to have a tight muscle and then you just constantly like bump over it. You want to go super slow with this. Even like a bit of an ab workout. Okay, that was good. How's everyone doing? We still have a whole nother leg to do. Do you have time? Good thing there's water and wine. Oh, Rochelle, you're funny. Okay, let's do the other side. I need to get rid of this. Keep going, team. You got this. Oh my gosh, I know. We're going to have to do the whole thing on the other side. So I'm just going to do like a mini glute up to the hamstring. And I roll it down and then start to do my quad. Again, you can put your foot here when you first start. And so just getting up into that hip and trying to breathe into it, relax. This would be a good spot for a ball. So, yeah, finding all the spots that are most irritated. So now you want to do that lateral one. So again, you've got your foot planted so that you can take a bit of the pressure off. Any more questions? How are we doing? He's sweating up a storm. I know, it's painful. But I'm glad you're here. Elise! Oh, okay, answer a question. Hey, Darren. How long do you suggest holding a trigger spot? You'll never want to go more than a minute, but just wait a few seconds. Like wait sort of 15 to 30 seconds. Janice. Hi, Janice. So yeah, let's say I found a trigger point right here. So I'm just going to sit here for a little bit. Really tune your mind into what you're feeling. Is it really tight? Does it feel like it's releasing? Does it feel like it's going to relax? So I would say just hang on there for at least 15 to 30 seconds. And then from that point on, just see how you feel and if it's releasing. Never hold it for any longer than 1 minute. Because at that point, you want to reassess because that can decrease any circulation and blood flow and actually hurt the muscle as opposed to help it. So a few good little spots. And thanks for tuning in, Elise. You too, Darren. I see you have a question there. Good morning. And yes, low back pain is a thing for me. All right. Well, this is exactly what you need. So if you want, you can start from the beginning and watch everything that we've done. So we started with the glute med, glute max, down into the hamstrings, and now we're working on the quads. So we're almost done. Probably feels like it's been a torturous 48 minutes. Again, if I start to feel like, okay, my glute feels a little bit tight again, then I move on to the glute and then I come back to the quad. So this is a bit of a process. It's a learning experience for your body and for you. So just make it whatever you want it to be, but use the main guidelines of glutes first, hamstrings, and then turn over into the quads. I find that helps the body relax more efficiently. If your glutes are loose, then everything else would just follow suit. So I would probably never recommend just doing quads first, because then it will probably hurt more than if you did the whole sequence. And why do you want more pain? I don't. Oh, that's good. Great. So we've done the external quads, the lateral outside quads, and then moving into the rectus femoris and into the hip. Joanne says, it has been a good learning process. Good. Glad I can help. And this also translates to, like, Joanne, I was just thinking about you going back to work at the hospital. That's stressful. And I know, I know you love your job and all that stuff. Like, I probably shouldn't say love. I don't know. I'm just assuming. And sometimes it doesn't feel like stress, but being in a chaotic environment is pretty stressful. and it translates into your body. So if you're feeling emotionally overwhelmed, then you can probably storing it somewhere in the body, whether that's the hips, the shoulders, jaw, wherever your spot is. Mine's my digestive system, unfortunately. But we hold stress in different places because it's an unnerving feeling of like something's happening. I feel out of control. I feel lost. So it's like your body tries to close in on itself and into that fetal position to protect yourself. That was the nice warm feeling and position that we were in the womb, where we were safe, and someone will forever take care of me. And now we're out of that womb. We're in this crazy, weird, wild environment. And so the feeling of coming into ourselves actually tries to help us relax. But in essence, what we do need is to open up more. Open up to, open up physically, open up emotionally, mentally, all of that stuff, which almost sounds counterintuitive, like an oxymoron, but it really is what we need, especially right now, like opening up to help each other and be there for each other and open up to possibilities of what all of this craziness will hold for us. It may not be immediately, but in the future, who knows? Who knows what'll happen? Even Rochelle, your little post there, you said that people are more friendly right now. Like people you pass in the park are actually saying hello. Like this is a thing. This is like really unfortunate that we lost that for so long. So things are happening. Things are changing. We're having more perspective, more humanity, more humility. So I'm curious to see what this will be. So. All right. How's everyone doing? Like making a mess over here. Okay. Wow, I almost went an hour. It's pretty exciting. So again, if you want more than that, that's a learning experience right there in itself. But if you want more, you feel like your glutes are still a little bit tight, then I would recommend using the ball like I was showing before, and then finding different spots on your glutes, like the glute med, piriformis into the glute max, and then putting it on the floor and then pushing in. If you can't get on the floor, like we were talking about Miriam, go against the wall. So put it like this. You can stand, obviously. I'm trying to keep my face in the screen, but yeah, find different spots and then roll that way. So, Darren, best places to pick up a foam roller. I have one set of this kind left. If you want to do a drive-by. So that's something to think about. Otherwise, I think you can find them sometimes at like thrift stores, Sport Check, all of that. Even Winners. I don't know what the shopping rules and regulations are right now, but if you do need one ASAP, I do have one. So message me about that. Okay, how's everyone doing? Are you okay? Everything okay? My legs feel so good. So that's really going to help your low back, sciatica, pronating of the feet, plantar fasciitis, upper back pain. Once your hips are relaxed, everything else feels nice and relaxy and ooey gooey and wonderful. So give it a whirl. Thanks for tuning in, for checking in, for staying this long. It's been almost an hour. But once you start doing it, it'll be a lot quicker. Throw a nice show on, some music, whatever, a meditation, and see, just see what happens. Have a little dance party with it. Winners is closed and all those places are closed. I heard Winners closed. Okay, so Darren, message me if you really want a foam roller right now. You can also use a, what's that thing with the dough kneading thing. Whatever, can't think right now. If you do a foam roller, keep doing it. If you don't, at least grab a ball, try and roll your glutes out. And thanks for tuning in. Okay, I think either tomorrow we'll do some upper body like exercises, or we'll do some lunges or something. If there's anything that you want to see, yes, rolling pin. Thanks, Darren. Rolling pin. Thanks, Elise. Rolling pin. Oh my gosh, I'm glad you're here because my brain's not working. Isolation brain. John says, thanks for doing this, Lisa. Greatly appreciate you taking the time to help everyone. You're so welcome. I love doing it. It's lots of fun. It's helping me socialize too. So thank you for tuning in, and I hope to see you tomorrow, or at least another day, because I'm going to keep doing it every day at 9. Upper body exercises, Rochelle says. Perfect. Karen says that was very helpful. Thank you. Have such a wonderful day. Check in with me if you ever need anything. If you're having pain, you're welcome, Joanne. You're welcome, Karen. Everyone, thank you. And I'll see you tomorrow. Have a nice day. You're welcome, Darren. Bye.